Mr. President, I want to talk just for a little while on the Hutchinson Amendment, which basically says that while the healthcare reform bill that President Obama and the majority passed last year, while that's going through the courts, that anything dealing with it would be put on hold until the courts decide whether it's constitutional or not. The reason that this is an important amendment is because states, private companies are being forced to put and spend a lot of money putting programs in place that may or may not have to be put into place if this bill is indeed struck down as unconstitutional. During the health care debate last year, I raised a constitutional point of order against the individual mandate because, frankly, I believe strongly that it is unconstitutional. A few of the courts around the country have agreed with me that it is unconstitutional. Unfortunately, that constitutional point of order was voted down along party lines. But there still is a very good possibility, and I'm hoping that the courts will see it this way, that this bill will be struck down as unconstitutional. And because there are no what are called severability clauses in the legislation, in other words, if one part is found unconstitutional, the entire bill is unconstitutional. Well, the individual mandate is the place that most people are focusing on, and if that's struck down as unconstitutional, the whole bill will come down, and yet states, with all of the program, the exchanges that they have to set up, literally will be spending hundreds of millions of dollars in trying to comply with a law that may be unconstitutional. We shouldn't have them go through that. We should actually have an expedited procedure to go through the courts, put everything else on hold so that we can determine whether this thing is constitutional or not. Now, let me talk just a little bit about some of the problems that we're seeing with the health care bill. First of all, we know that this is raising premiums. It was promised that the average premium in the United States would go down by about $2,500 per year. Well, I'll just give you one quick anecdote. Yesterday, I was on the phone with one of Nevada's largest employers, Steve Wynn of Wynn Resorts. Steve is known to be probably the most union-friendly, the most employee-friendly employer in the state of Nevada, has been for years. His employees love him. He takes very good care. He pays well, has good benefits. Well, he told me yesterday that they did a study from 2005 to 2010 of their health care cost. They increased on average of about 8% a year. This year, and he said specifically because of this health care bill, their increase was 12%. So that's a 50% increase in the rate of growth of their health care cost. Well, what did that mean to the average employee that works for the Wynn Resorts? First of all, Wynn Resorts shouldered a lot of the cost, but the economy in the state of Nevada is pretty tough right now, and it's pretty tough on the employers. Well, they passed on some of those costs to the employees. It means an additional $900 a year in cost to the average employee that works for Wynn Resorts. Well, this is just one story, but it's a story that I heard repeated across the state of Nevada over and over again. And while 2/3 of our economy is on consumer spending, is incentivized by consumer spending, if you take $900 out of the pockets of the average employee in my state, and I'm sure that's being repeated across the country, well, that's less money that people have to spend to encourage economic growth. We know that this bill, which was over 2,000 pages, which, very few, if anybody, read it, and if they did read it, I can guarantee you that almost no one understood it, even the people who wrote it, now has over 6,000 pages worth of regulations, which once again are incredibly complex. And unless you're a large company who has experts, who has lawyers who can search through this to try to figure out what that means to you, it's very difficult to understand. There was over $500 billion taken out of Medicare. And it wasn't taken to shore up Medicare. It was actually taken out to create a brand new entitlement program. So you take $500 billion out of Medicare and put it toward a new entitlement program instead of shoring up Medicare and making Medicare a better system. There were also higher taxes in this bill, literally hundreds of billions of dollars in higher taxes. And you know, they passed it, and they said it was just the health insurance companies that were going to tax, and it was just medical devices that were going to be taxed. There were 11 different new taxes in this health care bill. One of the reasons that I oppose the health care bill. Well, let me just give you a real-life example of one of those taxes, what it really means to patients and to future cures. One of the companies that produces, it's an extraordinary device for people who have uncontrollable seizures. Epilepsy, common name for seizures. One of the treatments for that is an electronic device that actually helps reprogram the brain. They actually implant this. It's kind of like instead of a pacemaker for the heart, it's like a pacemaker for the brain. Well, that's a very expensive device. It's over $20,000. The company that makes that device puts most of the money that they make back into research and development for making better devices. Because of the new tax, they're not going to have nearly the resources to put back into research and development to develop better products to help more patients in the future. And to tell you, if we wouldn't have this device in the first place, many people out there have completely uncontrollable seizures. Well, with this device, over half of those people actually are able to control their seizures. Nothing else works. No other medication works for them, but over half of them are able to control their seizures because of this device. These are the types of things that this health care bill is doing damage to our health care system, which is, by all accounts, the finest health care system in the world. The biggest problem with this health care bill is it didn't go after the #1 problem that we have in health care, and that's the cost of health care. We understand that health care is too expensive in the United States. Even though it's the finest quality, it's too expensive. So what we should do is strike down this health care bill as unconstitutional or repeal it, and then start with a health care reform bill that goes after the true problem in health care, and that's the cost. Well, what can we do about the cost of health care? Well, we all know that, first of all, that something we should absolutely do, that many states are doing. State of Texas is a really good example of where it's been successful, and that's to change our medical liability laws, to rein in these out-of-control trial lawyers across the country that are driving up all of our health care costs. We all know that doctors prescribe all kinds of unnecessary tests just to cover themselves in case of that one lawsuit. Well, when good medical liability reform bills are put into place, what happens is the true victims of medical malpractice actually get compensation because there aren't as many frivolous lawsuits clogging up the courts. But the other thing that happens is the cost of medical liability insurance, the cost to our healthcare system goes down. The Congressional Budget Office just came out with saying that there would be approximately $70 to $80 billion in savings over the next 10 years if we enacted medical liability reform. I think that number is very, very low, but it's not insignificant. But there's many other things that we can do with healthcare, a healthcare reform bill that brings down the cost. First of all, we need to put the patient back at the center of the healthcare universe. We understand that today we have what's called a third-party payer system. The person receiving the care is not the person paying for the care. We need to put the person that's receiving the care back with what's known as some skin in the game so that they start talking to their doctor. Their doctor has to talk to them. This can be done through things like health savings accounts. Health savings accounts combine a high deductible policy with a health savings account either that their employer puts in or they put in, and then they go and actually negotiate with their doctors. The beautiful thing about that is they don't have to worry about a gatekeeper. Anybody that's been on an HMO understands you have to go through a gatekeeper to get to a specialist. Well, if it's your money, you can just go to any doctor that you want to go to. And the doctor has to be accountable to you because it's your money. If we had over 300 million people in the United States shopping for health care, we understand that market forces will drive down the cost and bring up the quality. Unfortunately, the government right now already controls health care pretty much in the United States. It pays almost 60% of total bills. When you add them all up, about 60% of the bills are paid for by the government in the United States. So the government already controls health care, and that's the reason we continue to see costs in health care skyrocketing over the many years, until recently, where the costs even are now going up faster. So this health care bill, reform bill that was passed last year, some people call it Obamacare, that bill is actually making things worse, not making things better for health care system of the United States. So, Mr. President, I believe strongly the Hutchinson Amendment, which would freeze any of the implementation of the health care bill until it is decided in the courts whether it's constitutional, is a vital amendment to making sure that states don't waste a lot of money, that private sector companies don't waste a lot of money complying with a bill that may be struck down as unconstitutional. And this is money you can't get back. Once it's spent, it's gone, and we can't get that back. And we already know how much the states are struggling with their budgets right now. You're seeing what's happening in Wisconsin, Ohio, my state of Nevada. That's happening all across the country. So we need to put this bill on hold until we know whether it's going to be constitutional or not. Mr. President, I yield the floor.